Hello, this is Miguel Cardona, Secretary of Education. I'm glad to be with you today at CareerConn. When I was a student in Connecticut, I explored different pathways to see what I'd be interested in, and all of that helped prepare me for my career in education. And I know you've had an opportunity to explore different careers. Regardless of what you choose something you love, take a risk. I know that if you do, you will contribute to a better Connecticut and a better country. Good luck to you. Enjoy the conference, and I hope to see you soon.
Hi, my name's Tina Schaefer. I'm the Director of Admissions at American Institute, and I'm here to talk to you about the Diagnostic Medical Stenography Program, also known as ultrasound. First, I'd like to talk about the prerequisites for the program. Students prior to entering the program must have either a 2-year associate's degree in the medical field, which includes a 160-hour patient contact clinical, or a bachelor's degree in any field. Once they've completed those prerequisites, they may apply to the program. Sometimes people think about ultrasound and they think, babies, when you're pregnant, you go get an ultrasound. But there's so much more to the ultrasound field. There's so many different areas. There's vascular, there's ligaments, veins, abdomen, cardiac, many different specialties that students can go into. Once you complete the program, you can take a general, which all students are required to take prior to graduating, and a specialty. So at that point, you can determine, do I want to do OBGYN? Do I want to do vascular? Do I want to do strictly abdomen? Students also will take those specialties and their general through the ARDMS, which is the American Registry of Diagnostic Medical Stenographers. Currently, the salaries in Connecticut for an ultrasound technician on an average is $80,980. I'd like you to listen to one of our graduates. I think that will sum up this healthcare field for all of the programs that were presented to you today. I think her words ring true in every program.
8 years ago, I lost my son, 12 years old. Absolutely, I was working very professionally with a love in medical field, but when I stayed with my son in the hospital, almost 6 months, I really found out what's mean to work in medical field, to be employer. Because even he was 12 years old, a couple of times he was telling me, I don't want this nurse anymore to be in my room. Like, from the expression, for walking, you know, sometimes there is a body language. At this point, I mean, I understand it means a lot, your behavior in medical field. It's very important. It's not only the therapy that cures the patients. It's your word, it's your smile, it's your eyes, it's everything that can be helpful.
I think with that particular video, and again, it rings true in all the programs, with the diagnostic medical stenographer, not only do you have to have skills as far as being able to hold the probe correctly, scanning the correct organs, viewing the scans to make sure that the quality is good and the information is passed on to the physician and the healthcare providers, but you need to have just that, the compassion. A lot of times when individuals are having ultrasounds, it's not just for a healthy visit of a baby. It's maybe they're having issues and some underlying issues. So I think it's important that the compassion is there as well to be able to explain the procedures to the patients, as well as performing them in a professional manner. And again, I think it rings true to all the programs that were offered to you today. Thank you for your time, and I look forward to speaking with you.
Hey everybody, my name is Liz Johnson. I am the campus director at Cortiva Institute in Cromwell, and my partner in crime today is
Yesenia Almodovar. I'm an instructor at Cortiva Institute in Cromwell.
Thank you guys for coming today and listening to our presentation. We're going to talk to you a little bit about the massage therapy program. You know, one of the big questions we always get is massage really part of healthcare? Guess what? It really is. 52% of massage consumers had their last massage done for medical reasons. And also, just in this past year, Connecticut changed one of the state laws, and this is something that's been so important for our industry, that the law changed now that where doctors, if they have to prescribe opioids to one of their patients for any longer regimen than longer than 12 weeks, they also have to give them alternate therapies like massage therapy, which is such a great thing because it opens a lot more doorways for massage therapists. We're also seeing the number of hospitals offering these alternative therapies like massage growing every year. And those referrals to LMTs like Yesenia are just skyrocketing. There's a lot of power of touch and healing. Now, what does massage do to the body? Yesenia, why don't you tell us all about that?
Well, actually, massage, believe it or not, will reduce inflammation. It will help circulation in your body. So if you have any stagnation of blood on your legs, on your arms, it will improve that movement of blood. It will circulate lymphatic drainage, so reduce inflammation also. Stress relief and relaxation, you will be able to get a better sleep at night. It will improve joint mobility, reduce pain on your joints in your body, reduce effects of chemotherapy. So you will be certified side of the school to be working with patients, cancer patients, and it will reduce anxiety and depression, believe it or not, without medication.
You know, massage is pretty magical in what it can do for the body. You know, and one of the other questions we get a lot, what am I going to learn in school? You know, there's so much that you're going to do. You know, things like anatomy and physiology, pathology, kinesiology, ethics, business, you know, and all different massage, you know, modalities like craniosacral and Thai and Russian sports massage. But one of the most important ways that we teach is by hands-on learning. So Yesenia, if you could talk a little bit about how we teach with hands-on.
Yes, in every single class, we have exchanges. So students are exchanging everything that they learned up to that class at the end of the learning outcomes. We'll be adding to the class, let's say, a pathology. We'll give students a pathology and they will assess the client, the student, to work on bolstering, how to better do it in a better way, so it will be comfort for the pathology that the student has. Kinesiology will be learning the movements of the muscles, how to assess a body, and even orthopedic assessments. So looking at a gait of a body, working with on balances in the hips joints, and the knees, and body, full body.
You know, what are the requirements to become a licensed massage therapist? Got to graduate from high school or get your GED. Then you also need to graduate from an approved massage therapy school. One of the things that students also need to do is they're going to take what's called the MLEX. That's a licensing exam, and there's a lot of prep work that we do to help you to get ready for that. Now, every state in the country has a little bit different of a requirement. In Connecticut, we require 810 hours, which is more than pretty much almost every other state out there. There's only 2 states in the country that you can't go directly and apply to be a massage therapist. So that opens a lot more doorways, and it's something we're really thankful that Connecticut does. You know, what other areas of healthcare can you work in? You know, like we mentioned, hospital work, oncology, maternity, pediatrics, rehabs, wellness clinics, hospice. There are so many areas of massage that you can work within healthcare. You know, job outlook. You know, according to the BLS, it's projected to grow 21% from 2019 to 2029, which is much faster than the average for all occupations. Demand is just increasing every day. You know, how are you going to get paid as a massage therapist? You have a lot of control over your schedules, how you want to work, what you want to do. Sometimes you're going to work for other people. You may get an hourly wage. You may have your own business. You may do splits, commissions, plus you get tips. I want to introduce you to a couple of our grads. Amy Hendry is doing a lot of soft tissue work and work with myofascial work with in-season athletes. She's currently working with the Boston Celtics and the WNBA, the Connecticut Sun. We have Leah, who is a certified pediatric massage therapist. She is working with families helping their kids overcome medical and emotional needs. And sometimes massage can really add something, especially with kids with autism. There's so much power with massage with that. Liz Benoit. Liz worked all throughout this pandemic as a CNA, and she knew she wanted to do more. Nursing didn't feel right, so she went back to school, became a massage therapist. Now she's finding she can help heal through the power of touch. Then we have Jackie. Jackie just made us all laugh through her whole program. You can see she's just ball ball of laughter all the time. She loves Reiki, energy work, but her real favorite specialty is orthopedic massage because it's really helping mitigate physical pain. Then we have Tiana. Tiana, I know Yesenia and I both love Tiana quite a bit. Tiana is a massage therapist, a meditation coach, a military veteran, a sexual assault survivor, and she owns her own business. She opened her business a week and a half after she graduated from school. She is doing so much with helping therapeutic touch and helping people to be touched in a positive way and helping them to learn more about their bodies and how they work and how they can best feel best, for themselves. And that therapeutic touch is so, so powerful. Then we have Shantae. Shantae does so much with lymphatic drainage, working with athletes, doing a lot of prenatal and postnatal care. So as you can see with some of our graduates and some of the programs, there's so many opportunities with massage therapy to incorporate into the medical field. And we really thank you for coming and listening to us talk about massage therapy.
Yep. See you soon.
See you guys soon.
Bienvenidos a todos. Welcome to all. My name is Marilyn Calderon, and I'm the Executive Director of a post-secondary institution in the state of Connecticut. It is an honor and privilege to stand before you to start off this health career path on the patient care technician aspect. But before I do that, I want to share a little piece of my story. My parents are born and raised in Puerto Rico with a 2nd and 5th grade education. I never had the opportunity to really have a very clear career path. And I wanted to start in a post-secondary school system that wasn't referred to back in the days when I started as a post-secondary. It started off as an associate's degree program for the Gateway Community College programs. I share this with you because no matter what walk of life you are from, and if you have your language as being one of those barriers that keep you from really believing in yourself, everything is doable if you really focus in on the assets that you have to offer the world ahead of you. Our institution, alongside all of our post-secondary programs that are going to be presenting today, are really laying the foundation for you to have open pathways for you to have options and really educate yourself in areas that really matter. As you're looking for the most cost-effective investments in your educational growth, please consider the patient care technician. This will entail you to actually get certified in 4 different content areas that entail CNA, Certified Nurse Aide, as your first career track. Becoming a CNA as a Certified Nurse Aide entails you to, first of all, complete the state-approved nurse aide program that's accredited with 100 fulfilled hours of both clinicals and course of studies. And the second portion of that would be the completion of the state credentialing exam and apply at the state registry to become the CNA Certified Nurse Aide to enable you the opportunity to work in different environments. The typical workday of a CNA would entail that you would become a Certified Nurse Aide and you would actually arrive at the respective site early, because early is always on time as you are assigned patients in your care schedule. Then the second piece would be the daily routine that might include dental care, self-hygiene assistance, social and feeding connections, transitions and transfers safely with patients. And once again, it's that connectivity with the patient and CNA that's really critical. The potential salary of a CNA by Connecticut salary standards of a certified nurse aide professional, you may earn anywhere from $29,360 to $42,370 a year. The next piece would be phlebotomy technician. The phlebotomy technician really does require you to have a steady hand and a steady way of actually bringing in patients and showing that you actually have that ability to smile through your eyes, especially under these new COVID conditions. Becoming a phlebotomist technician entails you to complete the state-approved phlebotomy technician program with also 100 hours of classroom and clinical instruction completed. And the second portion would actually entail you to have the completion of the national credentialing exam, which is also state-approved and also sponsored and facilitated here on site at different post-secondary institutions. The typical workday of a phlebotomy technician The phlebotomy technician may start their day very early. They should have attention to detail. Drawing blood from patients, may be found working in a lab, may help with blood transfusions depending upon location of work. And they would also have to label all tubes and withdrawals accurately with paperwork. Potential salary of a phlebotomy technician. By Connecticut salary standards, a phlebotomy technician professional may earn anywhere from $31,050 to $46,880 a year. The next portion would be actually pursuing your career as the electrocardiogram technician, an EKG specialist. Becoming an EKG electrocardiogram technician would entail the completion of a state-approved EKG technician program. And secondly, you would be completing the national credentialing exam and become a certified electrocardiogram technician. The typical workday of an EKG technician is connecting electrodes to electro leads of ultrasound equipment, assisting physicians during codes by performing the ECGs and assisting with CPR, correct patients' heart monitor data, basic arrhythmia knowledge, and communicate with patients, communicate abnormal EKG findings to patients, physicians, and provide emergency interventions for the life-threatening situations, document patients' histories and assess findings and report results to RN, which is your registered nurses. Potential salary of an electrocardiogram technician by Connecticut salary standards. As an electrocardiogram technician, you may earn anywhere from $33,160 to $54,990 a year. Certainly, last but not least, the patient care technician ability to earn 4 certifications is probably the most cost-effective investment you can make in your educational growth. Becoming a patient care technician entails you the completion of a state-approved patient care technician program and the completion of a national credentialing exam and become a patient care technician. That also entails you to have the grit to work potentially with many different diverse patients with different walks of life and different medical needs. The typical workday of a PC technician is helping patients at wake-up time with bath, dental hygiene, feeding, changing linens and clothing, etc., recording patient temperatures, respiration, and blood pressure, measuring body fluid input and output, obtaining blood specimens and performing EKG readings, turning and repositioning bed-bound patients, walking patients, listening to and communicating patient concerns to other medical staff. The setting in which you work will have its own rhythm and its schedule, so your routine may vary from places that you work. Potential salary of a patient care technician by Connecticut salary standards, a PCT patient care technician may earn anywhere from $30,420 to $46,470 a year. Each of us has our own narrative as to why we pursue our educational career in different post-secondary schools. It is really important that you understand that having the potential salary and benefits of getting certified in 4 different content areas is a win-win, especially for a cost-effective investment. The patient care technician will enable you the opportunity to work solely in different areas that you choose as your end result when your educational career comes to an end. You can work as a CNA, as a phlebotomist, as an EKG specialist, or a patient care technician in its entirety, but it enables you to actually work in the ebbs and flows alongside doctors, registered nurses, and other healthcare professionals to be at your optimal level and be more marketable in the working field. It is our hope that through this post-secondary expo, virtual expo, that you actually take advantage of this opportunity to find where you actually are going to be most instrumental and make it happen. The post-secondary experience is supposed to actually formalize your way and your entrance way into the medical field with comfort, connectivity, and most of all, the diversity that you're going to actually come across with different ebbs and flows of different ages and stages of development of patient care. We are very honored to bring to you this experience of walking you through our own hallways and our own institutions of giving, because without you, there is nothing about us without us. Our institutions of post-secondary education are all about the heart power that our students bring. We're the ventricles that come off of that heart. Without that heartbeat, our institutions don't continue to thrive and survive. We need you to continue pushing yourselves to be the best in the field, but most importantly, to see that the medical field is in a different realm of profession that enables any of us from many different walks of life the opportunity to open new pathways with options that really make us to be better individuals and better human beings, to give more in our society than sometimes we actually spend our times to do it. Thank you for being empathetic. Thank you for being the movers and shakers of our institutions of post-secondary schools. And most importantly, thank you for pushing yourself to be that heart power beside us in our post-secondary educational institutions. Thank you.
Hi, I'm Joanna with Lincoln Technical Institute, and I'm here today to talk to you about the Practical Nursing Program. If this is something you're interested in, you may be wondering what it would take to get into a program. You must complete high school or earn a GED, and there is entrance testing to qualify to be admitted into nursing programs in Connecticut. Entrance requirements for nursing programs would be to have completed high school diploma and a GED or a GED. An LPN program does not require prerequisite courses, so you can go right directly from high school into an LPN program provided that you're accepted. Entrance requirements also include an entrance assessment. Upon completing that and passing that successfully, students then need to have a clear background check in order to be permitted to go into clinical training. In addition, they will need a very extensive physical. Once the student begins the program, the courses that they'll cover will include anatomy and physiology, fundamentals of nursing. They'll have a number of clinical rotations beginning with very basic clinical training such as basic bedside care. That will evolve all the way up to assessing patients and dispensing medication. The program, as it evolves, clinical training evolves with it, and it goes hand in hand typically. After successfully completing the program, which typically run from 12 to 15 months, you will then pass exit exams from your institution. So next, let's talk about the licensing for this career. After successfully completing a one-year program, you will need to pass your national license exam, which are referred to as NCLEX. Once you've passed your NCLEX exam, you're ready for your career and ready to give care to patients. That can range from all areas of care. As a nurse, you're really the eyes of the doctor. Physicians will come and check on patients, but typically 24/7, it's the nurse who's giving care to that patient.
So what do salaries look like for the PN program? According to the Connecticut Department of Labor, your median wage is about $28.18 an hour, which is roughly over $58,000 per year. They also have found there's an expected 9% job growth in this field over the next 10 years, which equates to over 65,000 jobs. This field is in great demand due to the aging population because of the recent pandemic, COVID-19, that has had its impact around the world. What does a typical day look like for someone in this career? As a licensed practical nurse, you can work in many locations such as doctors' offices, long-term care facilities, hospitals, and more. You can work a variety of shifts such as days, weekends, evenings, part-time or full-time. You'll work collaboratively with other nursing staff and doctors to ensure the best care for your patients, taking vital signs, performing tests and procedures, and keeping patients comfortable, whether the elderly or children, will be a frequent responsibility. Hi, my name's Tina Schaefer. I'm the Director of Admissions at American Institute. Some of the programs we offer are dental assisting. What you can expect from dental assisting is not only to learn chairside skills in assisting the dentist in routine examinations, but you're going to learn how to mix with cements and creating crowns and molds, as well as some administrative skills, booking appointments, inventory, scheduling different procedures for patients. It's a very clinical program. Some of the things students will do after the program is they'll work in some specialty orthodontist, as well as routine dentist, surgery offices. They come out with a lot of entry-level skills, and it's an extremely hands-on program. Currently, it's number 14 of the best jobs without a college degree in the US, based on the US News of 2021. As far as upward mobility within the career, it's average. Stress level is average. However, the flexibility is above average. The salary range in Connecticut for a dental assistant coming out at a 25% would be $38,270 a year. Not bad for a 12 or 18-month program. The average medium range is at $44,840. With experience, down the road obviously, at a 75% would be $50,220. The next program I'm going to talk to you about is medical assisting. Medical assistants work in solo practice, group practice, laboratories, walk-in centers, urgent cares, specialty medicine. Some of the skills a medical assistant will perform is minor surgeries in office, suture removals, blood draws, finger sticks, throat cultures, pregnancy testing, eye exam, as well as some administrative skills, which would be answering phones, booking appointments, inventory within the office. Some of the salaries, once completed at the program for a medical assistant, on a 10 to 25% range, would be between $31,010 a year to $34,400 a year. The medium range for a medical assistant within Connecticut is $38,680. Medical assistants are the heart of the healthcare. They're utilized in so many different areas and are very much in demand. Let's hear from a graduate.
A career for me is like a passion, something that you want to do for the rest of your life. I always say that if you do what you love, you'll never work another day in your life. And so it's more joy. You're just being paid to do something that you love to do. And that's like you're offering your labor free, but others are recognizing that it's important and just compensating you for it.
The final program I'm going to speak to you about today is medical records. There's many areas that include medical records, whether it's a medical biller, medical coders, health information technicians, medical registrars, and healthcare practitioners. Some of the areas, a biller may just be collecting information to send out to different insurance companies and so forth. Registrars are medicals that book appointments and gather information from patients. In the state of Connecticut right now, the hourly wage for a healthcare registrar or medical billing and coder or just a coder is between 20 and 25% of $30,410 to $48,020, with a medium range of $77,980.
There's a whole cycle of the process from when the patient first goes into the hospital or a doctor's office. And so the cure needs to be number one. And the last thing a patient needs to worry about is that the medical bill is not done properly, it's not coded correctly. And so I have a passion with being thorough. And so with that passion, I knew that I'd be the right person to not make mistakes and to take my time as if this was a family member whose account that I was working on, that I'm working on and touching. And so that alone was enough reason for me to want to further my career into this field.
Thank you for your time. I look forward to speaking with you and answering any further questions you may have about the programs I offered today.